comes to emergency, and systolic BP is 60 mm. He has sustained a stab wound to his chest. You can see that in the 6th intercostal space. Jugular vein is distended. The breath sounds are normal. That means it rules out the possibility of a pneumothorax. Sometimes in trauma to the chest there can be tension pneumothorax. Trachea is in the midline. Heart sounds are not audible. So that is a classical example of a pericardial tamponade, which is preventing the heart from getting filled because heart is surrounded by a lot of fluid. That's the reason jugular vein cannot drain, and you have a elevated JVP, muffled heart sounds, and the classical features of cardiac tamponade. 70-year-old woman comes for elective coronary bypass grafting. There is a carotid bruit, though she does not have any syncope or vertigo. So, what is the next step in evaluating when you discover carotid bruit? You have to do the 4-vessel Doppler of the vertebral and carotid circulation and know the degree of the stenosis of the vessels due to atherosclerosis, and accordingly take a call. 10 days after admission to the hospital, patient develops chills and temperature, hypoactive bowel, tender abdomen. Then what is the most likely possibility? What are the complications that can arise after acute pancreatitis? There can be an infection, and that lead to pancreatic abscess is one of the important complications that you should expect, especially in a febrile patient in the backdrop where he had pancreatitis. A 24-year-old nulli gravid, she is diaphoretic and her temperature is 37, and she shows blood in the vaginal vault, diffuse abdominal tenderness, there is a pain with cervical motion, and she had cramps in the lower abdomen for the past 6 hours, and her pulse is 130, BP is 80/60. So typically this is a history of ruptured ectopic, etc. So first thing is resuscitation, intravenous administration of fluids in view of the low blood pressure is the first step to manage any case of hypotensive shock. 52-year-old with 5-month history of the pain in the left knee exacerbated by walking long distances, and there is a crepitus with a flexion and extension, and x-rays of the knees are being shown. You can see that the knee joint space is decreased unilaterally, which is a case of osteoarthritis. That's the reason weight loss program is the most important part of your clinical management is what you need to remember. A previously healthy 32-year-old man comes to the emergency, and the right knee is showing warmth and erythema, and x-ray of the knee is showing increased space, which is sign of effusion of the knee. So what do you want to do? Arthrocentesis is the first step you need to do to diagnose the cause of the knee joint effusion. 57-year-old woman, inoperable small cell cancer of the lung, and she has a stable angina controlled with nitrates, and the laboratory studies are showing sodium 128 and urinary sodium of 78. X-ray of the chest is showing an upper lobe mass. So classically, a hyponatremic individual with a lung mass, what is it likely to be? It is a small cell carcinoma excessively producing ADH, leading to the development of the syndrome of inappropriate ADH secretion. Most of the endocrine paraneoplastic syndromes are associated with small cell. Only exception is hypercalcemia associated with the squamous cell carcinoma is what you need to remember. A 3799 gram female newborn, initial examination